alaikum wa rahmatullahi ta'ala wa barakatuh. Welcome back again, viewers, to this week's edition of Health Show. We've been talking about the topic of dental anxiety, and I've been interviewing my special guest today, with Dr. Abia, and also the guests from the public, which, alhamdulillah, we had one of her patients, Holly Mason, and her granddad, Paul Pritchard, who kindly came and sort of contributed to the show as well. The line is still open for you to ring and ask questions and tap the brains of Dr. Abia in this new pioneering work. But in the meantime, I'll continue to get more information about this for the rest of our benefit, inshallah. So, Dr. Abia, if you can just take us through this method of assessment of anxiety you've devised, can you just briefly tell us all about it?
Sure. I don't know if the camera can bring close up.
No, I don't think so. It's better if you just quickly go through it.
It has two parts. The first part is a self-reported part, which I ask the child to answer the questions there. And the questions in a logical order, like, you know, sitting in the waiting room, and then when he entered the surgery, when he sit in the chair, etc. The idea is to have only 3 faces, because, you know, according to literature, if you have 5 faces or 7 or more, this will confuse the child which face to choose. And also, when you do for researcher as well, when you do the statistic analysis, they tend to have like the first 2 faces as not scared, the middle as neutral, and the last 2 faces as scared. So there is no point to confuse the child and waste the time for the clinician as well. So this is only 3 faces with a neutral response at the end: happy, okay in the middle, or scared. I just ask the child to tick under 1 face for every question. And this is the self-reported part. The second part is the cognitive part, which include the child, questions for the parents, and the dentist as well. So the first 3 questions ask about the cognitive side for the child, like, do you feel shy at the dentist? Do you feel shy by the look of your teeth? Are you worried about losing control at the dentist? These are very important questions for us to understand more about the cognitive level and the cognitive status, negative, positive, for the child. And we found that very strong relationship between the cognitive status and the level of dental anxiety for the child as well. And also, this is the first cognitive dental anxiety measure worldwide, and also the first scale to assess also to correlate the expectation of the parents about the behavior of their child, and then you correlate this with the answer of the dentist at the end of the treatment. So how was the behavior of the child? Do you think he was happy, he was okay, or he was scared?
That's before the treatment?
After the treatment.
After the treatment, okay.
So everything before the treatment, the dentist at the end of the treatment, he just can put his score, like happy, okay, or scared for the child. So it's only one last question for the dentist at the end of the treatment.
So is this applicable to children and adolescents, or can we transfer it to big adults as well?
Yes, at the moment, we did the reliability and the validity test among this group, 6 years and over. We validate this in English, and inshallah, next week I'm going to travel abroad to validate it in Arabic countries, so Arabic people also can get the benefit to using my scale.
So then it becomes more worldwide.
For adult, at the moment it's just been validated for children and adolescents, but maybe in the future we can just modify the word, because this has a child-friendly language. So maybe we just can change some words to make it maybe applicable for adult as well, but in the same structure.
I think that will be very useful, because there are many of us who would rather avoid anesthesia if we could, by going to the dentist. And if this kind of method works in adults as well, which there's no reason not to, then I'm sure it will be worthwhile. How much time will it take compared to hypnosis? Is it about the same time or different time?
No, this one...
I know you haven't done it for adults.
For adults? Are you talking about the scale?
The scale and the hypnosis.
The scale, just 3 minutes. The hypnosis, it takes longer time, 30 minutes to 60 minutes.
Okay, so
Yeah, longer time.
Yeah,
Yeah.
much longer time, inshallah. So if I can just go back on the kind of dental conditions you normally treat and how many of those you will apply this method to.
I did all sort of treatments for children, but in the last 2 years, I tend to be focused just to see the extremely anxious patients, extremely difficult cases. So, alhamdulillah, يعني, I have completed treatment of dental anxiety for many cases. And the feedback from the parents and from the patient themselves, I'm really pleased by their feedbacks. You know, they give me cards and gifts and things like that, like appreciation.
Yes, yes.
And they are happy to support this new method of dental anxiety treatment. So hopefully, you know, if we can find the right environment to make this applicable,
Yes,
to everyone,
that will be useful.
Yeah.
And therefore, coming back on that is, what percentage of patients going anesthesia could be avoided by this method?
At the moment, there is the number of GA referral is extremely high without any scientific justifications. I have reservation about general anesthesia, because I believe that not all the cases, you know, really need to be transferred for general anesthesia. If the dentist give more time and attention to the child, then he will protect the child from unnecessary exposure to the risk of general anesthesia. And you know, the problem is also, you know, when we have the consent for general anesthesia, most of the dentists, they just tend to focus on the side effect of general anesthesia from dental point of view, but nothing for medical point of view. You know, nothing.
Yes.
They just talk about the like pain, injection, infection. Sorry, pain, infection, or bleeding. So that's just the medical side effect, but not the. Sorry, just the dental. I'm confused. Not the medical.
Not the medical, right, okay. Alhamdulillah, I believe we have a caller, Mrs. Brown. Hello? Hello, Mrs. Brown.
Hello.
Hello. What's your question, please?
The little girl that we've just seen,
Yes.
Holly, what's the future hold for her with dentist treatment? Obviously, her teeth will be growing down, but the ones that she's had put in won't be. How will you deal with anxiety as she gets older and gets into her teens?
Okay, thank you very much. That's a beautiful question. So, like one of your patients, we had Holly earlier on. I mean, if she is to have or to need dental treatment in the future, how will this treatment have helped her cope with that, or does she need to go through it again?
Thank you for the caller. This is very good questions. Actually, it addressed very important point that treating dental anxiety in a younger age is much better than to treat it in a adult or later on, because you know the anxiety will grow up with the child.
Sure.
If you don't treat it in an early age.
Yes.
So if we prevent and treat the dental anxiety in a younger age, then this will stay for him, you know, like for the rest of his life, because now some dentists, they said that we want to protect the child from the scary things because he's anxious, so we transfer the child to have general anesthesia. And the literature said that actually the dental anesthesia will make his anxiety worse, will increase the anxiety, the hospital environment,
with the general anesthesia.
you know, the induction room,
Yes.
so many stuff around, the morbidity after the operation, all of this will increase the anxiety. And then, but if you treat the anxiety using the drug-free methods, then you will leave very good positive experience for the patient, which will stay for the rest of his life, you know. But if he has bad dental experience, this might stay for the rest of his life as well.
Yes. Alhamdulillah. So inshallah, we hope to have more callers, viewers. We're waiting for your call to tap into this pioneering work from Dr. Abia, inshallah, in the few minutes we have left. So coming back to that, Holly has been very brave, actually, and one of the things she promised us is that she'll be talking about this program or this treatment method to her friends as well. So not only learning about it or not only experiencing it, they can actually help with other children of their age groups as well, alleviating their anxiety. Do you think that's a positive?
I believe it is positive for Holly's and case like Holly. It is positive because actually the anxiety could be learned and could be unlearned as well. So when you have the children at school, they talk about their bad dental experience, or parents at home, they talk about injections and the use of sharp instrument at the dentist. All of this could trigger the anxiety level for the child. But if you talk about it in another way, in more positive way, then this will give, of course, good result and positive effect. And Holly is now, I feel like she is now one of my patients who are really helping me to spread this message for the rest of the other people.
Other people, mashallah. Sister from London, salaam alaikum.
Walaikum salam. I just wanted to ask, sorry, I just wanted to ask, when you have a child that's growing up and they go through this, they have to have treatment. My dentist said they can't remove a tooth because the child is under 8.
Okay.
So, I mean, what do you do? Because the tooth is really, really bad. So what do you do with that? I just wanted to ask that sister a question. Thank you very much.
Okay. Okay. Wa alaikum assalam wa rahmatullah. Now, the sister is asking that her child, we don't know the age, but her child has got a bad tooth and the dentist is hesitant to remove it because the child is underaged, in quotes. This is what she's been told. Is that normal for dentists to say that?
Actually, the question is not really clear. Underage, what is the age of the child, and is the tooth permanent or primary or permanent?
Yeah.
We need to know this.
Well,
if she can call us back, then I can give you the right answer.
Okay, but
I need to know the age of the child and the type, which tooth.
Okay. Well, she may not necessarily know which tooth, but if we can say, is there any age at which time a tooth should not be removed in a child, no matter how bad it is?
Actually, the answer is no.
Okay.
Because depends on the state of the tooth, depends on the diagnosis. If the tooth is really bad and the child cannot sleep at night and give him hard time day and night, then I don't think there is a problem to remove this tooth, or instead of removing it, maybe root canal treatment or any appropriate restoration or filling. So this is general answer, but we need to know.
No, the child is 4.5 years. I've just been told that the child is 4.5 years old. 4.5 years old.
4.5 years old.
Yes,
okay, so that's mean deciduous teeth.
Yes, yes.
Okay, if the tooth is restorable, then we can do treatment for it. We can do the root canal treatment. We can cover it with stainless steel crown. So there is different sort of treatment. If it's unrestorable, then why not? Yes, he can take the tooth out if it's completely unrestorable and broken.
Okay. So, sister, it depends on the extent of the damage the child has to the tooth, obviously. Some teeth are best left and medical treatment might be sufficient, and in other situations, they has to be removed. If there is any question as to whether you believe what has been said, then obviously there's always a need to ask for another opinion somewhere else and make sure the opinion is consensusly agreed among or between two specialists. That will be sufficient, I think, inshallah. So coming back to this now, I know we haven't got much time left, but how do you expect your kind of program and this new thing to roll out to the rest of the public and rest of the dentists to use either in this country or abroad? What will be the next stage? How do we say it's cost efficient or cost effective in delivering?
We can always compare. We can always did comparison studies to see the cost from if we want to find about the cost. Of course, when you treat the child on the chair, will save lots of money for the NHS or for the government, rather than to treat the child using drug or sedation drugs or the general anesthesia. Of course, it will cost a lot because, you know, just actually you don't use any drug for it and you don't need any equipment for it.
So if we're going to roll this out, what will be the next step? I mean, you're single-handed at the moment, apart from your group at the university where you are working now.
The next step, I hope, you know, from the people who has like the authority to support me to have the dental phobia clinic, and I believe it will be the first dental phobia clinic for children worldwide. Yeah. To be operated by dentists and, you know, using psychological methods and dentists on the same time. So also on the same time, I'm teaching at the moment the postgraduate student in University College London, and I'm teaching them about the dental anxiety, the relationship of dental anxiety and the pain as well, the assessment of dental anxiety, how to measure dental anxiety. I'm teaching all of that at the moment. So I hope not only to teach the postgraduate where am I now in UCL, to teach all the dentists, you know, worldwide, to explain to them what's the importance of using this new method, and what's the important this will give, you know, benefit for the patient and for the money also for the government.
Okay, alhamdulillah. I think that is a very nice way to conclude this program. So thank you very much, Dr. Abia, for being with us. And I'm sure we have benefited from your input on this. And it's an encouraging research and project, and I wish you all the best. So inshallah, we'll be back next week with a different program. But in the meantime, I thank Dr. Abia, thank Holly and Pritchard, and we'll see you soon, inshallah. Assalamu alaikum wa rahmatullahi ta'ala.